hernia stapler. This video provides basic instructions for using hernia stapler. Always refer to the instructions for use packaged with the product for complete instructions. Intended use, contraindications, warnings, and precautions, etc. Intended use. Hernia stapler is intended to facilitate positioning of surgical mesh for implantation on soft tissue during laparoscopic or open surgery to repair abdominal hernial fascial defect. Features: titanium tack material, good biocompatibility, and MRI friendly. Two working lengths available to meet the demands of laparoscopic and open surgery. Matte finish shaft, no reflective light in procedure. Ergonomic pistol handle design for comfort and easy manipulation. Instructions for use. First, take out the product from the package. Remove the tip protector. Second, for LW350 version, used under endoscopic procedures, insert the product through appropriately sized choker cannula. Third, place the distal tip of the product on the target site. Apply light pressure to the target site during placement of the helical fastener. First, to fire the product, press the distal tip against target site. Try to keep the tip perpendicular to the mesh and squeeze the trigger completely. Make sure to fire the trigger to the end, otherwise the trigger can be returned back automatically. Do not manually return the trigger back. It may cause mechanical failure. Fifth, while firing the product, apply external countertension when possible to the area being stapled to ensure secure fastener placement. Sixth, repeat the steps 3rd to 5th for placement of additional fasteners all along the length of the area to be approximated or fastened. Precautions and warnings. First, product supplied sterile using an EO process. Do not use if the package is damaged. Second, do not reuse or sterilize. Reusing or re-sterilization may compromise structural integrity of the product or lead to product failure. Third, reusing or re-sterilization may also create a risk of contamination of the product or cause patient infection or cross-infection, including but not limited to the transmission of infectious disease from one patient to another. First, do not use the product if it exceeds the expiry date. Fifth, applying excessive pressure against the distal tip of the product may stall or jam the instrument. Sixth, do not use product on tissues which cannot be inspected visually for hemostasis. Seventh, if the total distance from the surface of the tissue to the underlying structure, bone, vessels, or viscera is less than 4 mm, or may be compromised to a total distance of less than 4 mm, use of the product is contraindicated. Eighth, this product should not be used in tissues that have a direct anatomic relationship to the major vascular structures. This would include the deployment of helical fasteners in the diaphragm in the vicinity of the pericardium, aorta, or inferior vena cava during diaphragmatic hernia repair. Ninth, do not use ischemic or necrotic tissue. 10th, if a helical fastener becomes jammed, rotate the product counterclockwise. 11th, after application, always inspect the surgical site carefully to ensure hemostasis. Thank you.